Living the good fat life with your host Karen and Sherri. They'll help everything align for your body, soul, and mind. The good fat life, whether change comes slow or dramatically. The good fat life will help you sort things out organically.
I know, it makes us laugh every time, Sherri. Happy Thursday.
Oh my gosh, what a day. So we have so much to celebrate.
I know. Look at our new studio vibe here. Thank you to Rob and Johnny and the Speakeasy. We just love the new setup, right?
Yeah. Here at Wayne Media.
Yeah.
And a new magazine.
Yes.
Yay, our latest issue is out.
Good Fat Life.
You can find it online at goodfatlife.com, and you can also, if you'd like to have this beautiful hardcover issue delivered to your home, you can do that too, right?
And you can click on the QR code and also get a digital subscription. That'll be up in a few minutes. But this issue's on play, right? It's all about play.
Yeah.
Play is one of, we've been talking a lot about self-care, and self-care, one of the things we discovered is play is really important for adults, right?
Yeah, and it's not even self-care.
No,
I
it's
mean,
just
it's
care.
not even
it's
not even like what you do when you have nothing better to do. It's essential to our self-care and our overall health and wellness.
Right. Who knew? Right.
Who knew? And it has been a fascinating. I have to say, I mean, every issue is fascinating, but this one has been the most transformational, I think, for me on a daily basis.
It's made things a lot more fun and silly.
It has.
Yeah.
It has.
Yeah.
And also another thing, it's really, really brought to the forefront is the importance of celebrating celebrate those things, right? We have a new magazine out.
I know, right?
So we need to celebrate that.
Yeah.
And just those little things every single along the way, because the more we celebrate, the more they come in, right?
And the more we practice having them, and it just goes on, and it's a manifestation, basically.
I don't know. It's like the lightning bolt came down yesterday on that, and so,
literally.
Actually,
we got struck by lightning yesterday.
Yeah, it did.
It's,
So, anyways, and so since then, Karen, I've literally set up 12 celebrations of things that I was just like letting slide.
Yeah, good for you.
And so one of them is our new issue. Is
yeah,
out, right?
we're gonna have a celebration. Yeah,
and I think we have to celebrate the new studio.
Oh my
too,
gosh!
right?
Yes,
Right?
thank you to Rob
yeah.
and Speakeasy and Johnny and everybody. Yeah.
So, and then speaking of celebrating,
I know we have another great guest, right? We always are so lucky. They always come right on time. It's exactly what we're supposed to hear, right?
Right. So, would you like to introduce her?
Yeah. Well, you kept saying let's talk about CBD more. Let's talk about THC, and then lo and behold, I was introduced to Cathleen Graham. So thank you so much, Cathleen Graham, for being here.
Thank you guys so much for having me.
She is a cannabis nurse. Is that correct?
That's correct.
So tell us about you and who you are and where your journey began.
I am a registered nurse certified in hospice and palliative care, and it was my journey as a hospice case manager that brought me into cannabis nursing.
Okay.
So as our law changed in Michigan by 2009, more people were coming into hospice care vocalizing that they were using cannabis products to help manage some of their end-of-life symptoms. And as their nurse, I became curious at how it was interacting with the prescription medications that I was giving, how it was, affecting their end-of-life journey. And then I thought, if they were using this to manage the symptoms that we were supposed to be charting on, where was our policy and procedure for charting on what they were using and how effective it was? And so it was a journey for me to advocate for the patient in changing policy inside of our workplace to acknowledge that people were using this as a medication, and how could we help support them and guide them to the best outcome for their journey. It led me into going into the political scene and testifying for the bills as they were being developed on a patient perspective and what they were going through. And
oh my gosh,
I was really happy
you rock.
Yeah.
Yeah. Like,
right.
Wow.
What inspired you to be an advocate like that?
The patients themselves and watching the journey. I had one patient, we will call his name Mike, And I had him unusually for 2 years and 4 months on hospice care. He came to us with tuberculosis, MAC, emphysema, and a tube feeding. And he had been a cannabis user for a long time, but because of his emphysema, he could no longer smoke. And it was working with him. And at the time, they had stores, but they weren't the type of stores that we have now that are regulated with tested product. And so he had a difficult time finding the right product that worked for him. And then when all those stores closed, it was his son became his caregiver. And it was reaching out to the community to find out how he can process essentially this cannabis to work for him. And I met Dr. Jeff Raber, who introduced us to cannabis tea. And so I taught the patient how to make it and his son, and it really helped him a lot. I watched it decrease his anxiety, increase his appetite. He got off the tube feeding and actually started eating food again. So that was a good thing. But what amazed me the most is I did not have to increase his pharmaceutical medications for close to 9 months.
Wow.
He stayed on the exact same dose, and I feel that the cannabis complemented those medications where he didn't.
And he was able to stay coherent, I'm guessing, more than normally in a hospice situation.
Yes, because he
What a
wasn't
gift.
taking the medications that sedated him. While the other people, I was increasing their medications at least monthly, if not biweekly.
That were not on cannabis.
Correct.
Yeah, wow.
Wow. And so that was a tea that he was drinking?
That he made into it. It did not get him intoxicated. It just helped his symptoms and decrease his anxiety too a lot. It decreased his anxiety and just calmed him down. And it was
so he could enjoy himself, his day, the time that he had
yeah. Instead of sleeping all the time.
Oh, yeah. And you give them so much extra time with their loved ones and being on earth like that alone, that's got to be worth everything.
It is.
Yeah.
It is.
Yeah. And just not being in pain and being aware and awake. Wow.
Yes. And in this journey, we have one of the only pediatric hospice groups in the state. And what we noticed is more and more pediatric patients came into hospice care utilizing some type of cannabis oil. And so then it became more of an ethical obligation to educate the staff to be able to take care of the pediatric patients and educate their family members on how to use it and what complications there might be, what to look out for.
So it sounds like you're like just breaking
pioneering.
ground, right?
Yeah.
You're creating it from the get-go.
Yes, I did. And I was fortunate enough back in 2016, National Institute of Health held a 2-day cannabis summit, and I was able to attend it. I got to meet some of the top world scientists and learned about the endocannabinoid system from the researchers themselves, and it blew my mind, really.
So what does that mean, endocannabinoid system?
Oh, thank you.
Like
Slow down, sister.
So we have a system in our body that is called the endocannabinoid system. It is a system that is not taught in medical schools right now.
Never heard of it.
And it is a system that helps maintain homeostasis in our body. And what that means is our body likes to be normal. And so anytime that we have, like, say, for instance, we stub our toe, it causes pain. Our body sends off a system of mechanisms to bring that back to normal, to decrease the pain, to bring your body back to a normal state. That's what the endocannabinoid system does. So you stub your toe, it immediately activates the endocannabinoid system to send your body's own endogenous cannabinoids that they make all by themselves straight to the area of pain. Should it be nausea or whatever is wrong with your body, it activates that endocannabinoid system to release the endocannabinoids to help bring your body back into that normal state.
That homeostasis.
And so cannabis recreates that state.
It attaches to the receptors inside our endocannabinoid system, helping bring it back to that homeostasis state.
So would you say that the cannabis is like the cavalry coming in? It's a help. It's help.
We're bringing it with us.
We're bringing
carrying
it.
It's
It's giving it a boost, resources, and supplies to help.
Like a traveler kind of thing?
To help it just do its job.
Yes, because sometimes, as we know in our world of stress, we can put our different body systems out of whack, and that includes the endocannabinoid system. And sometimes we need a little bit of supplementation to help it get back there. And we know what research has shown us is that people that have PTSD have lower levels of anandamide. And anandamide is the first endocannabinoid that they found that our body produces, and it's known as the bliss molecule. It is what gives us our happiness. And so we know people with PTSD have less levels of that. And we also found that their CB1 receptors have less density in them, so they aren't able to uptake those natural endocannabinoids. So somebody with PTSD having that situation and knowing that it physically changes the structures in your brain, having cannabis to help supplement that and balance it out really helps people with PTSD, simply because of the structures that are changed in the brain when you have that disease process.
That's fascinating. I'm just like,
I know.
Oh my gosh, is that?
Yeah. I know just with my own cannabis use, it does feel like when you use it, it's somehow like scans and like detects what you need in your body. You can feel it. You can literally feel it. Like I have problems with my wrist. You can really feel it going into my wrist and like working. Like you can feel it, if you get really attuned to it.
Yes, that's your endocannabinoid system. The cannabis connects to it and supplements where it needs to go. So if you have nausea or pain, that's what it's going to do. It's going to help in those areas.
Wow. It's fascinating.
It's like, where to even start? And so what's happening with all of that? It's like we hear, I don't know what to believe. It's like you see things everywhere. And that's one thing at Good Fat Life. Karen and I really are committed to finding resources that's, the truth, accurate, because the truth can be lots of things to people, but just the facts. I mean, what can you tell us factually about?
There's a lot of misinformation out there about cannabis, and that still stems from reefer madness. What I like the journey. If you look back at cannabis, you can see that it actually used to be in the pharmaceutical industry. And it wasn't until, and there were laboratories that were extracting it and making medications out of it. It was even in infant drops. It's crazy. Like Eli Lilly, Park Davis, they made cannabis products. And
when was that?
1920 to 1940. And then 1942, it all ended. Of course, in 1937, with the Marijuana Tax Act, is when they actually stopped accepting prescriptions from doctors. But the laboratories didn't get that information. And so they still continued to process and research and develop cannabis medications. But in 1942, it was removed from the U.S. Pharmacopoeia. And so then at that point, all the laboratories stopped and everything was put up on a shelf. And it wasn't until, I believe, the 1960s that Raphael Mechoulam came into the picture, and he decided that he needed a project to work on and went back and discovered these things. And he is our godfather, or the father of cannabis, and he rediscovered THC and CBD. And then he is the reason that we know that we have a endocannabinoid system and our own body's endogenous endocannabinoids themselves.
Wow.
That is fascinating, right? It's just incredible.
Yeah. And it was all political reasons,
like
that
everything else,
pulled it out, out of the pharmaceutical industry and prohibition, and then the emotional things that come along with that. And so that's how you get all the myths of people saying it's bad and don't do it. And you have to dig through that and look at the science. And I like places like National Institute of Health and the researchers that are really doing the research and handing out unbiased information. And it takes somebody that knows how to read that research and interpret it and bring it into classes that people understand and can use in their everyday life.
So where would me, an average person, I'm not a scientist, I don't have a medical degree or anything, to read some of that stuff. So where would I go to find just facts?
Dispensary, right? I mean, one. That's what I can think of. Yeah.
And even talk about dispensaries. I mean, like, what is it? What is a dispensary? And because that's like all new.
Yes,
Right?
it is. And dispensaries are now legally called provisioning centers in the state of Michigan.
Okay.
There's only one other state that calls them that. Every other state calls them dispensaries. So just so you know, some of the staff inside the provisioning centers are not as educated as we want them to be, although it is a great place to get knowledge. If you're going to find knowledge, that's the place to go. I would say there are groups, like you can come to my webpage. I created it for that, and it's cannabisnurse.com. Inside the medical profession,
That's
there are
great to
other, like American Cannabis Nurses Association is a great association for us cannabis nurses. And then they hold conferences also yearly. And then there's a Cannabis Nurses Network, and it is Cannabis Society of Cannabis Clinicians also exists, and it's a group of healthcare professionals that want to bring that unbiased scientific information out to the public. Otherwise, you can get lost on the rabbit hole going down finding information.
Well, I'm so glad you brought up rabbit hole because
Yeah.
we're going to go in a rabbit hole for a second because I just want to speak to this too. This is going to blow Sherri's mind. She's thinking about becoming a psychedelic nurse as well, correct? You're thinking, yes. So tell us about that.
That's so funny. I was just listening to Michael Pollan's new book out that he was just talking about psychedelics and the impact of them, and it's becoming. I hadn't even really heard that you could use them.
Yeah, people are
Legally, or,
microdosing all the time now. Yeah.
It's like, so talk about that.
So as my journey in hospice kind of ended, I stepped into health and wellness. And as I became a health and wellness nurse full time and started doing,
When did this happen?
this happened, probably the full transition happened in April of this year.
Okay.
Where I left the traditional nursing world altogether and then entered the cannabis and health and holistic industry full time.
Done a lot in a short period
Wow.
of time.
Yes.
Yeah.
And it was during that journey that I noticed that people that are utilizing cannabis, that are coming to me for their consultations, are also curious about mushrooms and other modalities to help with their symptoms. And so it became, how, again, can I help support the people that are coming to me, and how can I become knowledgeable about it? And so I found it very fascinating that some of these places do use a nurse guide to help them. Like there's a ketamine guide nurse and there's a psychedelic guide nurse. And it's to help people experience this journey in a safe way, and that if anything happens, they have a medical professional there that can help with their plan to make sure that they're safe. It is just...
So give us an example of what that looks like. What do you mean? Like, what would be a safe, like how does a guide like help you through a safe experience? What does that look like exactly?
So you would set up, it's usually by Zoom. So the patient is comfortable in their home, and they set up where they're going to be comfortable and what they want to do. They usually have a buddy there that is somewhere in the house, so they're not alone, so that you can contact the buddy in case something happens. And then me as the nurse would set up the Zoom meeting. We play some nice relaxing music. We instruct them on exactly what to do, how much to take, how long to hold it in their mouth, when to or when not to swallow it, and when to spit it out if they need to spit it out. And then we, it's probably about a 40-minute session with the music, and you hold that place with them, and you hold peace with them.
Oh, lovely.
And you kind of monitor them and make sure they're okay without disrupting their journey. And then you awaken them back into their present time, and then help them come out of it and end the session.
So it's like you allow their body and mind to do what it's supposed to do, and you're just there to facilitate it. That's lovely.
Yes.
Just like really what the body's meant to do in a lot of ways.
Yes,
Yeah.
definitely.
So then the I don't know, what do you say, drugs, the tincture? I mean, what do you call this? The plants that they're
Psychedelics.
psychedelics.
Psychedelics, yeah. It's okay to say. It's
I know,
okay to
I don't
say.
even know the
We're not going to throw
language.
you up in jail, Timothy Leary. It's okay. Psychedelics, Sherri. It's all right.
I don't even know these words.
Yeah.
So anyways, so the psychedelics. So where do they get them?
They can, some are provided by a doctor, and then some are provided, on the street. You can, it's still, mushrooms are not a place where you can go into the store like you do a provisioning center to get
But
cannabis.
we should say you probably should be very careful about that.
Yeah.
We don't recommend that. Yeah.
Correct.
Yeah.
It's very scary to go get something off the street because you don't know the quality, you don't know where it's come from or how it's grown. So right now in that gray area, it's kind of difficult. We don't provide any of that. But I know some of, like the ketamine, it is a prescription medication. You have to get it through a doctor, and it's through a service. And then there's other modalities too. And I would say find your best source of where you're going to get it.
What is the cost involved in something like that? Is it really expensive? How does that work?
It varies. And like some of them, the nurse guide comes with your treatment. And I would say an average treatment is around $150
that's not
for
bad.
the hour.
Does insurance pay for it at all?
Sometimes it does, but most of the time it does not because it's a new field and it's not yet been covered. So. But like, see, somebody is going in for, say, ketamine, a guide, that if they have failed all traditional modalities for treating their depression or whatever they have that they're taking this for, then that might be an instance where insurance would cover it, where the doctor could show the patient has tried all these other forms and they have failed everything, so this is what I want to try.
And what is ketamine exactly?
It is a prescription medication that alters the mind. It's sometimes what we use in end-of-life care, but it's also used off-label, and so we found other modalities to use it from.
Is it like mushroom adjacent, or is it just a psychedelic, or what is what do you call it? Category
The
is
classification,
yeah.
I am not sure right off the top of my head. I apologize to you.
Yeah.
But it is new in the form that we're using it to treat, depression and things like that. Otherwise, it was used in other forms.
Can you tell us the two differences between like who would want to do THC and who would want to do the harder, like the psychoactive drugs, like the psychedelics? Like what patient needs which?
That depends on the patient. It's not really a decision that we tell the patient. Usually,
but
they
typically,
come to us.
what is something that I would come to psychedelics for to help heal?
When every other modality has failed, usually that's what I see people say that.
And that's mostly with mental.
Yes,
brain health.
depression, PTSD, some kind of mental illness that they have going on that traditional medications have not helped them with. And
Does it help with trauma?
Yes.
Okay.
And I see a lot of people microdosing on mushrooms that is actually very effective at decreasing their PTSD, their trauma experience, their anxiety, and their depression.
Now, can you ever mix cannabis and psychedelics, or no? That's never a good combo.
There are some people that do. And what we've noticed too is that some people that start mushrooms will actually decrease their cannabis consumption. And we don't know exactly why. Maybe they just don't feel like they need it anymore, or their symptoms are being managed. So it's kind of like they complement each other. And then we do have some patients that do quit using the cannabis and use only the mushrooms because that's the effect that they like.
Now, is it true? I've heard if you use psychedelics, is it always a cumulative effect, or sometimes you just need them once or twice and you're cured? What have you seen?
I have seen both. I have seen people that only have taken once or twice and like that's it. They don't need any more. And then I know people that continue it. They do it either once a week, every other day. Depends on who they are and what symptom they're trying to manage.
Do you have any before and after stories you could share with us, or things that you've seen that have been pretty miraculous that you would tout the qualities of those?
As far as the psychedelics, I have a lady now that I know that is taking the microdosing mushrooms. She has tapered herself off of the cannabis, and she is saying that it has helped her depression, and she also has a traumatic brain injury. And so it's helping to stabilize her mood, her depression, and she's stating that it is improving her memory.
Wow.
So,
yeah, no, a lot of people are struggling with memory right now. You don't usually associate memory improvement with drugs.
No, you don't.
Not at all.
And as we were talking about last week, or that slowing down. Self-care helps memory.
Yeah, right?
Yeah.
For
Right,
sure.
right.
Yeah.
That our brains
I
are
forgot.
that's right. That our brains are just so bombarded with so much that they can't keep up.
That's true.
And so that brings us back kind of to self-care, why it's so important to take care of ourselves.
Yeah. And just a little bit, the psychedelics are really interesting. I mean, so how does that work to help you get into that space of your brain where you can heal? Like, talk to us about the process of what it does exactly.
We are still not sure exactly what it does, but we're still doing research on it to find out. And there's actually a lot more of these medications inside and outside the pharmaceutical industry that we really don't know how they work to help the body, but we know they do work.
And they're mostly natural, I'm guessing.
Yes.
Yeah.
So you had said that you were having a consultation that's free, and then so you're doing a
for our
special offer.
listeners.
So
Yeah.
for our listeners, so talk about that. What does that look like?
So right now I contract with Hyatt Provisioning Center in Hazel Park, and they are offering all of my consultations free to their customers. And if you come in to see me to get a consultation to talk to you about developing a wellness plan for you and what type of cannabis might be good for your specific symptoms, all that is free. And then I guide you through that. They will give you a 15% off discount to any product that you buy in their store.
Yeah, so Good Fat Life listeners, you guys head out to, you got a special deal today. Thank you, Kathleen.
Yeah,
you
thank
guys
you.
take advantage of that. Yeah.
So tell me, how does that interact with alcohol or with other chemicals that we put in our body? Because it's all chemicals. So
It is. Even the plant, it does turn to, and cannabis does have many drug-to-drug interactions, and it's simply because of the way that it's metabolized. And anything that we put in our body is metabolized. We have enzymes that break it down and enzymes that build it up. And so cannabis is a natural vasorelaxant, so it immediately interacts with all of our blood pressure medications and heart medications. So it has the ability to decrease your blood pressure, but increase your heart rate. So you want to be cautious with people that have heart disease, especially somebody that might have AFib that has an already high heart rate. You want to educate them on the fact that THC could increase that heart rate, and you don't want to cause harm to them as long as they're aware. Now, all these side effects are minimal too that cannabis does have, although they are there. The first thing we need to know is that cannabis can complement your medication and increase it or decrease its effectiveness by up to 40%.
Wow, that's pretty
a big
significant.
deal.
Yeah.
It is. It's especially huge with opioids, because what we found is people that use cannabis don't require as much opioids as other people.
Hallelujah. Yeah.
Yes. But also a medication called diflucan, that if you've ever had a yeast infection as a woman, you know what that medication is. Cannabis decreases its effectiveness. So if you are using cannabis, you get a yeast infection, you are prescribed diflucan, know that you will probably need to take more of it.
Okay. Is there any like no-nos when you're using cannabis that you should not do? Is there any like a list of things? Like,
Yes.
Right at the top.
All the medication that your doctor says, don't take grapefruit with this, the exact same thing follows with cannabis. So if your doctor says, and most of them are like statins, like it'll say, don't take grapefruit with this statin, you're going to do the same with this cannabis. Don't take grapefruit with it and any other medication that your doctor says. Separate that cannabis use by at least 2 hours. You're going to want to monitor your blood pressure and check your blood sugars, because cannabis can affect both of those in a good way. So I tell people this: if you are on blood pressure medication, separate your cannabis or CBD use by 2 hours. But say you're on multiple blood pressure medications because you cannot get your blood pressure managed, that might be a time to consider taking your CBD or cannabis with that medication to help complement it, to help bring your blood pressure down a little bit more.
wow. And so what about, I mean, you mentioned blood sugar. So how does that, is there some, the word has just escaped me, a use with people with diabetes
Yes.
or type 1 or type 2?
Both of them. What they did find mostly is CBD helps to regulate the blood sugar and can actually drop the blood sugar values. And so it's important to monitor your blood sugars if you are a diabetic. Because,
And not to get the munchies, I'm guessing.
yes, because it can go the other way too.
right.
If you get the munchies and you eat too much and you choose those bad foods that increase your sugar, it can go the other way. But say you stay on your normal diet for diabetes, where you're avoiding all that delicious sugar that's not necessarily good for us, then it can help regulate that, and you might see a few drops in your blood sugar levels.
That's
So what about alcohol?
Oh, that was the first question.
Right,
you asked.
right.
Yes.
No, I have some of my friends have said they're not drinking. They're stopping drinking wine and taking gummies.
Yeah.
And so
and it's
so
more, I've heard it's more effective if you don't drink and you get you feel the effects of THC more.
You do. Cannabis and alcohol usually don't mix well together. I mean, the cannabis is going to complement the alcohol, and you're going to end up more intoxicated than you thought you were, and probably meeting the toilet a lot faster than you would have.
Oh, interesting.
So it can also help in the other way, that if you use a little bit of cannabis, maybe that one glass of wine is all that you need, but it can very much, balance it. And I do find that people will tend to stop drinking alcohol, and they prefer the effects of cannabis because they're not going to meet the toilet usually. They can if they have too many edibles and your body rejects it. That's where people get into the worst side effects of cannabis, is the edibles, where they get hallucinations and panic. But there's things that you can do to stop those side effects.
Now, when you administer the cannabis, does it come in all different forms for your clients?
It does.
Whatever they prefer?
Yes, and there are so many different types now. It's amazing. Excuse me. There are, of course, the smokable form, and then the vape form. And then the vape, you can do either the flower or the concentrate. And concentrates are a whole new ballgame because they come in all different kinds of forms. And that's just a really highly concentrated form of THC.
Is that like a wax or? Yeah.
Yes, it comes in wax, shatter, crumble, sugar, resin, rosin. It's like all different kinds of
all these things people would be arrested for saying all these street names. Yeah. Isn't that crazy? Right.
It is. It's just so
the world has gone mad.
Part of me is just like, oh my gosh,
we're going to be in trouble.
Exactly.
Yeah.
And then that's one of the things I love about Hyatt is they have so many. They have over 365 different products in that store, and
wow,
it makes it really easy for me as a nurse when I'm doing a consultation, because there's going to be a product in that store that is going to fit your needs.
What's the quickest way? Is it smoking?
Is
If you have pain, you should smoke it, or no? It just doesn't matter. It just depends how your body works and what you prefer.
Yes, because I can talk to somebody all day about smoking it, and as a healthcare professional, I don't really advocate for smoking, but say I talk to you, Sherri, all day about smoking, but you don't believe in smoking. You've never smoked anything. You don't want any smoke in your lungs. That's not going to do me any good. So I have to meet the patient where they are and what they want to do, what their goals are, and how I can help them. So we have microdosing products in there. We have a mist that delivers 2.5 milligrams of THC, and it's such a small amount, it's barely detectable on your tongue. And then we have upwards of 100 milligram gummies at one shot, and everything in between.
Wow. So what about the salves and stuff? Are those really effective? They really travel through the skin and stuff?
They do. So we have topical products work in our CB1 receptors that are right in our skin. They don't reach our bloodstream unless they have an uptake agent in them. So that's really wonderful for people that have to take a drug test. We've only had one patient that failed the drug test that used a topical product, and she put it on her feet. So I don't know if that's something to do with the feet, but generally you don't do that. Patches are really great. They last anywhere from 12 hours to 4 days, depending on the patch. I usually tell people that are going out exercising, like I have a gentleman that rides a bike, and so every time he spends that whole Saturday or whatever weekend that he's going out riding a bike, he grabs a patch and wears it throughout that whole bike ride. So
that makes sense.
So he does that. So he
preventatively.
Okay, so his body feels better.
Yes.
So it'd be
because-
almost like taking an aspirin or something.
Yes.
That we would have done historically.
Because outside of that, when he gets done with his bike ride, his lower back hurts really bad. So he just put the patch on the back, and it decreases the inflammation and the pain as he's being active throughout the day.
And so it's not. So is it masking the pain, or is it supporting his overall wellness by allowing him to get out and move?
It is supporting his overall wellness because the patch that he uses has CBD in it, and CBD is an anti-inflammatory, decreasing inflammation in your body.
Okay.
So that's a thing too. Most of the people that come in are missing the CBD component because we know 96% of cannabis has 0% CBD in it. So if you're using a cannabis product primarily, you're not getting the CBD. You need to look at the hemp plant or hemp products that contain CBD in order to get that. And that's what I tell people is your stability. Having that CBD in every single day gives you a decrease in inflammation in your body and helps support your endocannabinoid system. And what you use the other products for is breakthrough. Like what are you trying to manage? And then we will find the product that will meet that goal. But we want something stable to support your endocannabinoid system, and that's CBD.
And is your cannabis system, is it, so if it breaks down, then is this is one of the best ways to reinforce it and help it heal?
Yes.
So it can repair itself and
Yes.
you can go on your way?
Yes.
Okay.
And that's a good thing because it does help repair and support it. And so when you start out, you may start out titrating up to higher doses. And then you get to a point where you're like, I'm a little sedated now, or I don't feel like I need this much. And you could heal yourself and decrease the amount of cannabis or CBD that you need.
That's fascinating.
Yeah. So what does mess up besides post-traumatic stress? What messes up that system, the endocannabinoid system? What besides, is it pain? Is it injury? Or is it mostly just mental?
Life in general.
Yeah,
Because
okay.
inflammation, it's like when you have a system that is trying to
It's like
keep
clouding
balance.
the messenger or something?
Yeah. And your life happens and you have your ups and downs of I got hurt here, or I'm having an emotional distress here, or maybe I got sick and I'm nauseated. All that brings wear and tear to that system, and it's something the cannabis and hemp products help support that system.
So it like keeps the system kind of like finely tuned. It's like what we need for that system.
Yes.
Just like they say, everything you need is right in nature, look in nature. So it's just like proves that point. Yeah.
And I do a holistic evaluation when I talk to people, because a lot of the times, if you're talking about sleep, people that have insomnia or sleep problems, it's not just take cannabis and do it. It's how can you develop a bedtime ritual, and what other plant medicine is out there to help support you. Valerian root works great with cannabis. And if you have that right type of cannabis that you want to take at bedtime, sometimes people get our CBD tea and have a nice glass of CBD tea, take their valerian root at night, and they have a great night's sleep.
And then everything else follows from that, right?
Exactly.
Because you slept
Sleep's so
well.
important.
So all those.
And heart disease.
Wow.
And people don't realize how much sleep affects your health. Like
Yes.
if you don't sleep well, and Plus it's around the THC, like a lot of people are like, oh, if they have to stop drinking for one reason or another, they're like, oh, I miss just having a glass of wine. And like, there's something about like the ritual of all that. It's just sort of the same way with CBD, like however you, like if with a tea or smoking it, and there's like sort of a socialness about it, and it really can be lovely.
Yes.
Yeah.
It can.
Yeah. Instead of like, some, clinical kind of setting where you're giving yourself a shot or whatever, it actually can be like a beautiful, nurturing experience.
Yes, and that's what we want to try to create for
Isn't
the
that
patient.
novel? I know, it's like we've gone backwards this whole time, right?
Definitely.
Yeah. So talk to us about how when you realize, like, if we can use it for death, why aren't we using it more for life? Like,
That's a good question. A lot of the times now inside the medical profession, it's a last attempt modality instead of a first road try. I think that's why it became so popular in hospice, because it was more like, well, they're dying anyway, they can use it. And I thought that was just absolutely horrible to say, because You want that. A great mentor of mine named Sherri, who is the green nurse, she says it the best. It's about living your best life and helping others to do the same. And I add, until your last breath. And that's what we want. We want our best life until our last breath. Just because we're dying doesn't mean that we should be neglected. We should have those symptoms managed all the way to our last breath.
I love that. Or just that now you're just going to be on drugs that just keep you sleeping the whole time.
Yeah.
For the,
Yeah. We're like, so we're checking out. So it's like you have no value to society anymore. So we're just going to,
keep you drugged.
Yeah.
But I will say, when my body's in pain, I don't want to be, nothing looks good. Nothing sounds good. Nothing feels good. When your body's in pain, there's no joy.
Mm-hmm.
That's true. Mm-hmm. It is distracting from your life.
Right.
Yeah.
So, and I just want to ask about your experience with palliative care, because it's also it's something that we just never talk about.
That's true.
And
we stick it away in a corner.
We stick it away in a corner.
Death and dying,
and
we don't
so,
talk about it.
I think it's important that as we have the opportunities to have conversations with somebody with your experience, what do we need to know?
That there is a difference between palliative care and hospice care, and that palliative care is there to support you when you are diagnosed with a serious illness that is not curable. It doesn't mean that you're dying. It just means that, hey, I was just diagnosed with stage 4 prostate cancer, or I was just diagnosed with Parkinson's disease. Then I have another group that can help me navigate this. They can provide a nurse practitioner that comes out to your house that does the visit. They also provide a social worker. They help manage your pain, and they help bridge that road that you need to go to help. And you can still receive aggressive treatment. Just because you're on palliative care doesn't mean that you stop care. You can still receive all the aggressive treatment, research options, and everything that you need. It's just that extra support. And then when you get to that road where I'm having more symptoms, I'm now looking at probably the last 6 months of my life. I need more support in my home. I can't do this by myself. Then that's when we look at going over into hospice care. And hospice care comes to you no matter where you are, whether you're in the hospital, long-term care facility, adult foster care home, or in your home. They provide a registered nurse that increases their visits as needed, depending on symptom management or actively dying state. They provide a home health aide that can do your personal care for you, a spiritual care to take care of your spiritual needs, and then a social worker to not only take care of your emotional needs, but to put you in touch with your community resources. There are times where people do need Boost or Insure, and the social worker is great at finding those places in our community that can offer that at low or reduced cost for people.
That'd be nice if we all had I'm sorry, I'm way far back. Sorry, Johnny. Wouldn't that be nice if we all had like Lyspis? Like we had a little group like that for our whole life, supporting us like that.
That's awesome.
Yeah.
I love it.
Yeah.
Let's start it.
Yeah, exactly.
Yeah.
Wouldn't that be lovely? Like this, just a little group around you, like supporting your life and your health and your journey.
Well-being.
Yeah.
Kind of like what you guys are doing.
Yeah. Hey, we're doing it. Yeah.
Good Fat Life.
Yeah. Good Fat Lyspis.
There you go.
I love it.
Yeah.
One of the other things I wanted to say about hospice care is they deliver all your medications straight to your home. They provide all your durable medical equipment, deliver it straight to your home, all free of charge. It's all encompassed. You never pay a price for hospice care. It's usually covered 100% by Medicare, Medicaid, or insurance. It's a great, it's a hard road to accept, and it's hard to talk to your family members when you're dying and you want that support. The last thing they want to hear is, I'm dying and we need to call hospice. It's hard, but I want to tell people you will regret not calling them if you don't, because of the support and services that they offer. It is amazing and life-changing.
My mom was a hospice nurse, and for many years, and that was one of the things. It was really hard, when the patient passed. she would need a break, right, to go through her own emotion.
hard.
But that was one of the things that I noticed was really valuable, is that she could provide another resource that could care and be in the family that could help, that just provided somebody for the family members to talk to, and also for the patient to talk to, because they sometimes needed help being able to talk to each other.
Yes.
Yeah, it's very hard
Yeah.
for the family to understand sometimes and have someone to bridge that gap, right? Because there's a lot of different opinions about what should be done. And
Yes. Everybody has their own opinion about what plan of care should be developed, and instigating that and facilitating that discussion and making sure everybody is on the same page can be quite emotionally draining, especially during this time. But it's rewarding too when you finally get everybody on the same page that is agreeing to the patient's wishes. It's an amazing, wonderful time. It's, to me, as intimate as birth is, and it's all about giving the gift of goodbye, and that's what I learned in my journey. And speaking of what can alter the endocannabinoid system, grief can. When you are under extreme grief, when you are going through the loss of a loved one, it can alter the chemicals in your brain. And that's a good
Can you
point.
tell us about some of the grief that you've experienced?
Yes. Well, I want to talk first about this. Grief can alter the serotonin in your brain. And so we have antidepressants that block the reuptake of serotonin so that we can have more of it in our brain. Cannabis, on the other hand, helps our body create more serotonin. So it works as a natural antidepressant. So there are drug-to-drug interactions with antidepressants also, just to be aware. And so when you have that and you have grief, it can alter that. So just be aware of that to make sure you get help in grief counseling. And the reason, I would say the main reason that I went into hospice care is that when I was 6.5 years old, we were traveling from Michigan to Texas to visit my grandfather, who was in the hospital dying. And we ended up in a horrific car accident right outside of Springfield, Illinois. And it killed my sister. I was, again, 6.5. She was 15 months older than me, and she was my life. She taught me how to read, how to tie my shoes. She even brushed my teeth for me. I was her little baby doll. And sorry.
That's okay. Yeah, thank you for sharing.
I didn't speak for 2 years after that accident, and it changed my life, as you can imagine. And it was really hard to deal with, but it was, again, right after I turned 18, like a few weeks after I turned 18, I spoke with my father, who lived in California, on a Tuesday night, and Thursday morning he died of a massive heart attack at age 44.
Oh my gosh.
I did not, unfortunately, I was very young, and I was 8 months pregnant, and so I could not travel to his funeral. And both of the most important people in my life, I did not have the opportunity to tell goodbye. And so it was my goal as a hospice nurse to make sure that I gave the gift of goodbye to as many people as I could. And I called many people in from out of state to tell them, you need to come now. I had patients that we had Christmas in October because I knew they weren't going to make it to even Thanksgiving. And I am proud that I did that for those families.
Me too. And how has that helped heal you? Has it helped bring you closer to your loved ones?
It has. It has. It helped because I do it in their memory. It has helped me feel good.
Talk to us a little bit about, and thank you for sharing that. I know that was very hard. And talk to us a little bit about not being able to talk. Did you want to talk and you chose not to talk, or you literally physically just could not?
I was lost, actually. I have very little memory of that time in my life. I really didn't participate in much of anything. And My mom said I would nod my head yes or shake my head no. That was about it. And they caught me several times out in the backyard burying notes to my sister.
Oh.
And it was in fourth grade that I came back to reality. And I don't know how to explain it, of where I was and how I still functioned in life, I really seriously have very few memories of that time, and they came back in flashbacks in my younger 20s. But what brought me to is in fourth grade, we had a teacher that her daughter owned a farm, and it was her policy that 2 by 2, she took us all out to spend the night at her daughter's farm. Mm-hmm. And I remember waking up those were the days, don't you know?
Yeah,
you don't do
I
that
know.
stuff
Yeah,
anymore.
right.
But I remember waking up in that camper with her and coming back to reality. I can still picture it today, seeing that farm and waking up to it. So farms and horses and animals have a nice place in my heart. And I thank her for that journey. She was one of my favorite teachers. And I don't know what would have happened to me had that not happened. Mm-hmm. And it's scary to think where I was, especially to not have many memories that go on during that time. How was I functioning? What was I doing? And I wonder how many people are walking around like that nowadays that are in such grief that they're on autopilot and not really living.
I wonder,
there's
because
a
I'm
lot
a
of
real,
people.
this is going to be real woo-woo, but I'm a spiritual person. I wonder if it's almost like part of you went with that person that passed on, or that person's trying to bring you over, or you went over for a tiny bit with them or something. You were sort of in this purgatory maybe for a bit and then snap back here. I don't know. I have no idea, but it's fascinating, right?
Yes.
I mean, yeah. And do you look at that as a dark time, or you just look at that as a lost time? I mean, obviously awful because of what happened, but is it just like a time that was just gone and you're not really sure where you were? Wow.
It's a time that's just gone. And I'm not really sure where it's at or what happened to it. And it took me a while to get before the accident.
Oh, that's interesting.
It was like so traumatic that it tried to erase all of my memories. And so in my journey of myself back to health and wellness, what I found and one of the exercises was that spot of joy, and going back to my time before I knew trauma. And that spot of joy was my grandparents' house in Zealand. And we used to go there every weekend. We loved it. And they had 20 acres and we just run. They had a great big willow tree out in their
Sounds
front
like it was
yard.
back to a farm.
Yeah.
Yes.
Yeah.
And we would sit we would lie in there on that field and eat sweet clovers and cloud dream. And it was finding that memory and realizing that it was my sister lying beside me there in the field and laughing. And it brought back a lot of the good memories that I had prior to her death. And it gave me that this is what joy feels like. And let's bring more of this into my life.
Now, can I ask you, now that you've seen, I'm guessing you've seen many people pass.
Yes.
Has it helped you forgive the passing? Because I'm guessing that the car accident was traumatic and you might have seen some things you didn't want to. But did it make you more peaceful about death and the experience of death, and feel okay about the people that have passed on? Did it give you comfort in that way?
It did. It did. I used to, there's a certain point, it's not very often, but sometimes you can find a patient that is dying that is lucid and they are not here, but they're here. And I used to ask them, what do you see? And some of the stories that they told me were just amazing at what they saw. And then there were so many stories of past loved ones coming back to see. And it gave me comfort in knowing that whatever is there on the other side, they're at peace and they're in comfort. And I'm happy for that.
Well, I'm so happy that you found peace and comfort and giving other peace and comfort. And it shows you in the world that things that happen, that it seems so terrible, that can end up being like your light into the world, right? And you've taken it and made it a positive, and you've really helped so many people already. So thank you for that. Thank you for sharing that. Yeah.
Thank you.
and for your life work.
Yeah.
Oh my gosh. So when we close, we like to ask our guest if there's something that they would like to say to our listeners, a step that they could just take like right this minute, today, some little thing that they can do to move their wellness journey forward.
Yes. Learn to love you first and foremost, because nobody is going to love you the way that you love you.
Oh, it's beautiful. Wow.
Wow, that's
today has been
beautiful.
enlightening.
Yes,
Yeah.
it's
As always,
my
right?
gosh,
Yeah.
What a day.
Well, yeah.
So, and if people want to find you, Kathleen, where do they go?
They can find me on cannabisnurse.com, or they can find me in person at Hyatt Provisioning Center in Hazel Park.
Yeah.
And I did want to mention that Hyatt means life in 20 different languages.
Oh,
I
my
love
gosh.
that. Yeah.
And that's H-Y, spell that?
Hayat.
Hayat. Okay, got it.
And you guys go check it out, because for our Good Fat Life listeners, you get free consultation and then 15% off product with Kathleen Graham. So go into the Hyatt and ask them in Hazel Park and get hooked up. And we hope you guys have great health and wellness. And again, thank you, Kathleen, for being here. And I guess it's time to go
live our good fat life.
Yeah, our good fat. What do we say? Good fat life-spice.
Yes.
Let's go live our good fat life. Thank you.
Thank you so much. Oh my gosh.
Thank you so much for having me.
Our pleasure.